Alright, I'm on my way to the doctor to get an MRI after several weeks of their phone tag and other games to try to set up an appointment. So hopefully we can finally get this knee issue figured out so I can actually skateboard again. Okay, I'm about to go get some physical therapy done on my knee so I can skate. And yeah, so I'll let you know how that is because I really got to get ready for my Arizona trip so I can actually skate. Okay, so I just got done with physical therapy and my knee and thigh and ankles and hips and everything is just on fire and super sore. Okay, so I know the lighting is pretty bad because I'm using a webcam, and if I turn on the other lights, the white balance is a different color than my screen. So it's gonna screw everything up, so ignore the darkness. Anyways, I'm gonna explain what is going on with my knee. It's been going on since maybe last October or November, and I decided to finally get it checked out, and I got an MRI. I went to a doctor because it wasn't healing, and I just got done with physical therapy, as you can see in that little clip. So I got some little home exercises that I have to do with this band, and I'm gonna try to do some skating on the side while I'm doing that. But long story short is the MRI results came from my knee. I got them done, and it's on my left knee, and it's partly tendonitis along with some other problems. So I'm trying to break it down to how the doctor explained it to me with the sheet that they gave me. So this is the knee, and my meniscus here has some slight tears and fissures going on with it. And then up here where the doctor kind of put this little star, there's this area with the cartilage and near your kneecap that has like this little flap that kind of like opens and closes when you lift your knee and bend it and all of that. And mine is damaged and shaped a little bit differently, just I have no idea why, but it creates this weird locking up and popping that's happening with the knee. And there's a little bit of arthritis. So the reason why it doesn't hurt is because there's no opening and closing when I stand up straight, this is how it looks normally on your knee when you're standing up. So that's why there's no pain. But the pressure around my cartilage and tendons where my shin bone is, dude, I hate this autofocus on this camera on the Brio. Like I'm literally right here. So this is the whole list of all of the problems that I got with my knee. And I have the cartilage is fissuring and the suspected flap is extending and it's out of place and something like that. There is subtle tears along the meniscus that I have there. Other than that, it's just kind of tight, and then there is a amount of fluid build up around the joints. So that's nice to know. And then I have some worn out patellar cartilage with really bad inflammation and swelling and arthritis. So I'm in my 20s and I have arthritis and a bunch of other inflammation. So I've been having to do physical therapy, strengthen the supporting muscles because my knee isn't going to 100% heal and regrow. So I'm going to have to strengthen the surrounding muscles that are around my kneecap so it'll take off the stress of all of that weight that's just going straight into the joint and my kneecap itself. And it should help with some stability and take away the pain. But that tissue in there isn't going to regrow. And they said I may need knee surgery in 8 weeks if things don't get better. So hopefully the physical therapy gets better and I don't have to have surgery. But the reason I've been able to snowboard so much for the past half year is because when you're leaning back, you're going down a hill, but you're kind of leaning back. and most of your weight is on your right or back foot if you're regular. So I haven't really had any pressure with that. And then also landing impact off jumps is a lot different because you actually kind of land on the tail and then push it down. So it's kind of like landing in a manual on a skateboard, but you obviously wouldn't really do that in a skateboard unless you're me, which I like to do in my older videos. But the reason that I haven't really posted those skate videos is because it hurts, like, just to push. Like, if I extend, like, if I just stay with my knee kind of like this, it's fine. But once I start to bend it and put weight on it when I'm pushing regular forward, it absolutely just kills me. It feels like someone's taking a knife and stabbing it into my kneecap. And there's been a few times where my left leg has just totally collapsed and I've just fallen to the ground while pushing out of nowhere. So hopefully when I get this knee situation fixed, I can start releasing a lot more skate videos because summer's coming up. And, you know, I'd really like to get back into that because I got some new wheels on my skateboard and the weather's starting to clear up. So please stay tuned, and I promise I'll be trying to get some skateboard videos out once my knee is starting to get better. So in the meantime, I'm going to try to film other people, and I'll have a few cameo tricks. And yeah, so hopefully my knee gets better and I'm actually going to be able to skate again.